Welcome to the Deep Dive, where we take your sources and illuminate the most important insights. Today, we're diving into a really crucial, maybe often overlooked pillar of modern healthcare, the medical lighting technologies market. You might not think much about the lights in, say, an operating room, but these aren't just light bulbs. They are precision instruments, and this market, well, it's absolutely glowing with unexpected opportunity.
It really is. And what's fascinating here, I think, is the sheer scale of investment we're seeing. I mean, from a valuation of about $2.44 billion back in 2021, the market's projected to nearly double. We're talking $4.95 billion by 2033.
Wow, nearly double.
Exactly. And that's a compound annual growth rate, or CGR, of 6.08%. Now, that kind of consistent growth, it isn't just a number on a page, right? It signals a pretty fundamental shift in how we approach safety, efficiency, and accuracy in medical environments.
That jump to nearly $5 billion by 2033 it's quite remarkable. So it begs the question, what exactly is driving that consistent, 6% plus growth, especially since it seems like such a specific area of healthcare? What kinds of innovations are we actually talking about when we say things like high performance, precision, and hygiene compliant lighting?
Well, yeah, it's definitely far more sophisticated than just, brighter bulb. When we talk about high performance, we're looking at things like advanced LED arrays. These can replicate daylight almost perfectly, which is critical for accurate tissue color rendering during surgery.
Okay, I can see how that would be vital.
Absolutely. This precision is critical. Just imagine a surgeon needing to differentiate between healthy tissue and diseased tissue. Modern medical lights now achieve what's called a color rendering index, or CRI, of 95 or even higher. That basically ensures colors appear almost identical to how they'd look in natural sunlight, and that level of clarity. It directly impacts diagnostic accuracy and surgical outcomes.
Right. And what about that hygiene compliant aspect you mentioned? That sounds like it goes beyond just wiping down a surface.
Exactly. Yeah, much more. Beyond just sort of seamless designs that prevent bacterial traps, we're now seeing lights built with actual antimicrobial surfaces, or even integrated UVC light technology that can help sterilize the room when it's unoccupied.
UVC, so active sterilization.
Precisely. These aren't minor upgrades. You could say they're game changers for infection control, especially today when healthcare-associated infections are a major global concern. These features are becoming pretty much essential across operating rooms, ICUs, outpatient facilities, even diagnostics labs.
Okay, so with those impressive global figures and, the tech advancements in mind, where are we seeing the most significant activity geographically? Is there a region that's really innovating or leading the charge?
Absolutely. North America is clearly leading this charge, no question. Its market revenue is set to reach about $1.23 billion in 2025 in the forecast. It's expected to exceed $1.91 billion by 2033.
Okay, $1.91 billion just in North America. So within that, is one country really pulling most of the weight?
Yeah, it's a key observation, yeah. The United States remains the dominant national market. It's projected to account for over $1.49 billion of that total by 2033.
Wow, the vast majority.
It is. And this leadership isn't just about sort of sheer investment volume. It's really fueled by a cutting-edge healthcare infrastructure and consistent adoption of the most advanced surgical lighting solutions. Things like advanced optics for shadow management, integrated digital controls for precision.
Right, the top-tier tech.
Exactly. And we're also seeing robust, steady growth in Canada that's at a 6.75% CAGR.
Yeah.
And Mexico, too, with a 6.16% CAGR. So solid growth across the continent.
Okay. Now, moving across the Atlantic, Europe is also making a pretty significant contribution, right? Our sources show Europe's market size hitting around $885.2 million in 2025, projected to hit $1.38 billion by 2033. Are they innovating in the same way, or are there maybe different drivers at play there?
Well, Europe's growth is definitely heavily influenced by major economies. Think Germany, France, and the UK. France, actually, is noted for showing the highest growth. That seems to be due to a specific focus on enhanced surgical lighting innovations.
Interesting.
But what's really intriguing, I think, is the rest of Europe. This includes Eastern and Nordic countries. This segment is expected to surge with a CAGR above 7%.
Above 7%. That's higher than the overall average.
It is. And it seems largely fueled by substantial EU investments, specifically investments aimed at modernizing older medical infrastructure across those regions, which naturally includes upgrading to these advanced lighting systems.
Right, makes sense. Modernization equals new lights.
Okay, so we've talked about significant market sizes, but let's shift gears slightly to sheer pace. Which region is truly accelerating the fastest? That would be Asia Pacific. It's characterized as the fastest growing by pace, definitely. We're looking at a projected CGR of 6.94%. Its market is set to rise pretty impressively from about $587.2 million in 2025 to over $1 billion by 2033. This whole region is really a testament to rapid expansion in healthcare access.
Okay, over $1 billion by 2033 and growing fast. Within that dynamic APAC landscape, are there specific countries or segments driving that remarkable speed?
Definitely. India, for example, is registering a really robust 7.71% CAGR. That's quite high. And Southeast Asia is also showing strong momentum, as new hospitals and clinics come online.
Right, building new infrastructure.
Exactly. But the most striking figure maybe is for the rest of APAC.
Mm.
This includes a whole range of emerging nations. This segment is soaring at an 8.89% CGR.
Wow, nearly 9%.
Yeah. That's actually the highest growth rate across all regions for any specific segment we looked at. It really indicates explosive demand for modern healthcare facilities where these precision lighting solutions are frankly foundational.
Yeah.
And of course, you still have China and Japan showing continued strong performance. That's largely due to expanding hospital networks and also an aging population requiring more specialized precision lighting for complex procedures.
Okay, that paints a really dynamic picture in APAC. Now, heading down south, South America is also demonstrating some impressive emerging momentum. What's the story there?
Right, South America. The market there is poised to grow from about $210.6 million in 2025 to $361.3 million by 2033. This growth trajectory is led primarily by countries like Brazil and Argentina, but interestingly, just like in Europe and APAC, the rest of South America is also showing high momentum. We're seeing a 7.32% CAGR there.
Another strong rest of segment.
Exactly. And this seems largely supported by increasing public healthcare investments across the continent, plus ongoing medical infrastructure reforms, bringing more facilities up to modern standards.
And shifting gears again to the Middle East, their growth trajectory seems, well, a bit more modest comparatively. Is that maybe due to different priorities or perhaps adoption rates?
That's a good observation. The Middle East is projected to reach about $158.3 million by 2033. And while you do have countries like the UAE and Egypt seeing above-average growth, often driven by ambitious modernization programs, especially in their private hospitals, the region's overall CAGR remains comparatively lower, around 4.68%.
Okay, why the lower rate there?
It seems to be primarily due to a slower, perhaps more localized adoption of these advanced technologies in certain areas. It's just not quite the broad global push we're seeing elsewhere, at least not yet across the entire region.
Got it. So we've covered regions by market size, like North America, and by pace, like APAC. But which region is maybe the overall dark horse, experiencing the most explosive growth rate across the board?
Here's where it truly gets compelling, I think. Africa. Africa stands out as the fastest growing region overall. It boasts the highest KGR of any region, a stunning 10.14%.
10%. That's huge.
It is huge. This represents truly rapid market expansion.
Yeah.
It's expected to jump from roughly $59.9 million in 2025 to $129.7 million by 2033. It's more than doubling in that period.
A 10.14% CEGR in Africa, that's genuinely explosive growth. What on earth is driving that kind of transformation in the continent's healthcare infrastructure?
Well, think about it. That's nearly twice the global average growth rate we talked about earlier.
Yeah.
It really signals a massive push, often from a lower baseline, mind you, to upgrade healthcare infrastructure pretty much from the ground up. It's about bringing modern care, including appropriate facilities, to millions who previously lacked access.
So what are the specific drivers?
The key drivers seem to include improving healthcare access in nations like Nigeria and South Africa, for example, but also across the rest of Africa segment, too. And this is all supported significantly by global aid programs, international partnerships, and also increasing private sector investment. They're building and equipping new healthcare facilities with these essential high-tech lighting solutions. So if we try to connect this all to the bigger picture, what really stands out is that across the globe, from state-of-the-art operating theaters in New York to newly equipped clinics in Nairobi, the investment in precision lighting is becoming this undeniable essential component of modern healthcare infrastructure. It's really not just about visibility anymore. It's fundamentally about enhancing safety, ensuring diagnostic accuracy, and improving efficiency in critical care environments.
Okay, let's unpack that final thought. What you might initially perceive as well, just a light bulb, is actually a sophisticated, high-tech medical device. It's a vital piece of the puzzle, driving significant market growth, yes, but also profoundly improving healthcare outcomes worldwide. It's really a testament, isn't it, to how crucial specialized technology is, even in areas we often take for granted. So what does this all mean for you listening in? Well, it means that every time you see a medical facility, or maybe interact with one, know that behind the scenes, crucial high-tech investments are being made. Investments in seemingly small details, like the lighting, to ensure the best possible care is delivered. And this maybe raises an important question for you to consider. As healthcare continues its rapid modernization, what other seemingly quiet underlying technologies do you think are poised for similarly explosive growth? Technologies that are silently transforming how we experience medical care. We encourage you to keep observing, keep asking questions, and of course, keep diving deep.
Welcome to the Deep Dive. Today, we're looking into something you probably barely noticed, but it's absolutely vital in healthcare, the medical lighting technologies market.
Yeah, it's kind of amazing, isn't it?
It really is. I mean, just how much something seemingly basic like light impacts patient outcomes.
And what's fascinating here is just how critical this tech has become. It's not just seeing things clearly. It's about precision, safety, even diagnostic accuracy in, well, pretty much every procedure, way beyond just simple illumination.
That's a really key point. So what's actually driving this market's growth? And, where's it all heading? We've looked at some expert material to unpack the main drivers, the challenges, and some frankly surprising innovations.
Yeah.
Okay, let's unpack this, right? Let's kick off with what's fueling the demand. You might just think, oh, more hospitals means more lights. But it's a bit deeper.
Mm-hmm.
We're seeing this global increase in surgeries, more healthcare facilities overall, and yeah, that's partly down to aging populations, more chronic diseases.
Right, that makes sense.
But the core thing is the need for optimal lighting. Really top-notch systems to guarantee accuracy, precision, safety during every single procedure. It's like this quiet revolution in operating rooms.
Absolutely. And going hand in hand with that demand is just the incredible speed of tech advancement. LEDs, for example.
Yes, LEDs.
They basically dominate now. And it's not just energy efficiency or lasting longer. They produce hardly any heat, which is, crucial in surgery.
Definitely.
But it doesn't stop there. We're seeing smart features now, things like adjustable brightness, different color temperatures you can customize, intelligent controls, all tailored for very specific medical needs. Imagine tuning the light perfectly for the tissue type.
Wow. And speaking of specifics, it's not just about seeing clearly, it's also about what shouldn't be there, right? Like infections.
Exactly. There's a huge focus now on patient safety, infection control. So modern lighting often has antimicrobial surfaces, designs that reduce heat, all lining up with tough global standards. It's like a silent guardian in the room.
Okay, but, like any big technological shift, it can't all be straightforward. What are the main hurdles, the shadows in this picture?
Well, one of the biggest ones is just the cost. The high initial cost for these advanced systems.
Right.
Think about those integrated arrays or shadowless surgical LEDs. They need serious upfront cash. And that can be a real barrier, especially for, say, smaller clinics or hospitals outside the big cities.
Yeah, you can just picture the budget meeting.
Exactly. And even if they find the money, then you've got the headache of actually installing it, retrofitting.
Oh, yeah. Old.
Well, obviously, to get this cutting-edge tech into older hospital buildings, often you run into compatibility problems. Maybe there isn't even space. And then there's the downtime while it's being installed. It's a massive logistical challenge.
Makes sense.
Plus, you see much slower adoption in developing regions or rural areas. Lots of places still rely on really basic lighting, lack of infrastructure, maybe lack of awareness, or just funding. It slows down the global spread of these improvements.
So quite a few challenges. But despite them, innovation is still, lighting the way forward. And this is where it gets really interesting, I think. What are the exciting trends coming up?
Okay, yeah, a big one is hybrid systems, multifunctional lighting. So today's lights aren't just about light anymore. They're becoming integrated platforms.
How so?
Well, they have built-in cameras, sensors, connectivity tools. You can share data in real time, collaborate remotely, document surgeries. It's turning lighting from just illumination into like an information hub.
That's incredible. So much more than just light.
Right. And building on that, there's more focus on customization, ergonomics. Think flexible arms moving exactly where needed, touchless controls vital for sterility, or surgeons adjusting light intensity and color temperature with just a gesture.
Reducing fatigue, streamlining things.
Exactly. Making a real difference for the medical teams during those long operations. Helps them focus purely on the patient.
And what about AI? Is that playing a role?
Oh, definitely. We're seeing really exciting developments integrating lighting with AI and the whole smart hospital concept. Imagine lights that adjust automatically based on the procedure type, time of day, maybe even a surgeon's known preferences.
Wow.
That level of intelligence doesn't just save energy, it seriously boosts precision. We're moving towards these really smart, optimized healthcare settings.
Okay, so wrapping this up,
Hmm.
what does this all mean for you listening? This medical lighting market, it's evolving incredibly fast, driven by innovation, facing challenges, sure, but quietly transforming the places where we all get care.
Yeah, and it raises an important question, doesn't it? Could the next big leap in patient safety or diagnostic accuracy actually come from?
Well, from the humble light fixture overhead, not a new drug, not a new scalpel, but the light itself.
That's quite a thought.
It's about light becoming this active, intelligent part of healthcare delivery, fundamentally changing the care environment itself.
A powerful idea. It really makes you think about those subtle, often unseen technologies that support our lives and the critical services we all depend on.